Dr. Kumar, Professor and Head, SNS CPHS. Welcome to CliniRxMed, your channel for simplified clinical and medical concepts. We are going to explore the fundamentals of electrocardiography, often referred to as the language of the heart. We will look at how our heart functions as a pump and how we can translate its electrical activity into a readable diagnostic tool. The heart, let's use a hydraulic analogy. Think of the heart as a system of reservoir and pumps. Deoxygenated blood is collected in the right atrium, our first reservoir. It moves to the right ventricle, which acts as a pump to send this deoxygenated blood to the lungs, which acts as a purifier. Blood is oxygenated. Once purified, the oxygenated blood returns to the left atrium and is finally pumped out by the powerful left ventricle to nourish the garden, which represents the rest of the body. This process happens in two distinct circuits. The pulmonary circuit has a single purpose: to oxygenate blood by sending it to the lungs to release carbon dioxide and absorb oxygen. The systemic circuit then takes over, delivering that oxygen and vital nutrients to every organ and tissue in the body. Together they form one continuous life-sustaining loop. Looking closer at the engine room, the heart is divided into four chambers: two atria on top and two ventricles on the bottom. They are kept separate by a muscular wall called the septum, which prevents oxygen-rich and oxygen-poor blood from mixing. To keep blood flowing in one direction, we have gateways or valves. The tricuspid valve connects the right side, while the middle valve connects the left. Let's trace the first leg of the journey. Deoxygenated blood returns from the body via the superior and inferior vena cava into the right atrium. It transits into the right ventricle, which then pumps it into the pulmonary arteries leading to the lungs. The superior vena cava drains blood from the head, neck and arms, while the inferior vena cava brings blood up from lower body and the trunk. They both empty the right atrium, which acts as a receiving chamber. Before the blood reaches the right ventricle, it must pass through the tricuspid valve. The valve ensures that when the ventricle contracts, the blood doesn't flow backward to the atrium. The right ventricle has thinner muscular walls than the left, since it only needs to pump blood to the nearby lungs. When it contracts, the tricuspid valve snaps shut, the lung of the heartbeat. Blood is pushed through the pulmonary valve. It enters the pulmonary trunk, which splits into the left and right pulmonary arteries. The pulmonary arteries are unique because they are the only arteries in the adult body that carry deoxygenated blood. They lead directly to the pulmonary capillaries surrounding the alveoli, air sacs, where the magic of gas exchange takes place. Carbon dioxide is dropped off and fresh oxygen is picked up. On the return trip, freshly oxygenated blood pours into the left atrium through the pulmonary veins. It then enters the left ventricle, the heart's most powerful pump. Finally, the left ventricle ejects the blood into the aorta for distribution to the entire body. The pulmonary veins are the only veins in the body that carry oxygen-rich blood. Usually, there are four of them, two from each lung, that empty into the left atrium. As blood moves from the left atrium to the left ventricle, it passes through the middle valve. This is the valve most commonly associated with heart murmurs because it has to withstand immense pressure. The workhorse of the heart is the left ventricle. It is significantly thicker than the right. Its walls are dense muscle designed to create enough force to snap the aortic valve open and surge blood into the aorta. The aorta is the largest artery in the body. As soon as the blood leaves the heart, the aortic arches upward called the aortic arch, and through the branches, the blood moves to all over the body. Now that the blood has left the aorta, it travels through a network of similar arteries and capillaries delivering oxygen to tissues. Once the oxygen is spent, the blood becomes deoxygenated and finds its way back to the vena cava, starting the entire process described in our first step all over again. How is this movement synchronized? The heart is a mechanical pump governed by an internal electrical conduction system. Cardiac muscle fibers are connected by intercalated discs, which allow them to contract in a coordinated wave-like fashion. This ensures that blood moves efficiently from the atria to the ventricles and then out of the body. The signal follows a very specific wiring diagram to ensure the atria finish their job before the ventricles begins there. Integumentary discs are truly the secret sauce of heart coordination. They contain two vital components, gap junctions and desmosomes. Gap junctions, these are essentially tiny tunnels between cells that allow ions to flow freely. This means an electrical charge in one cell immediately jumps to the next, creating that wave-like contraction. Desmosomes. Think of this as molecular rivets. They physically hold the cells together so that when the heart muscles contracts with immense force, the cells don't pull apart. This mechanical pump is driven by a precise electrical rhythm. By measuring these electrical signals from the surface of the body, we gain a non-invasive view of cardiac function. This recording is what we call an electrocardiogram or ECG. To get a clear signal, we must prepare the skin. We use gauze and alcohol rubs to remove oils and debris, ensuring good contact. In many cases, chest hair must be saved or clipped so that the electrode patches can adhere securely. Next, we apply the electrodes. These sensors detect the heart's faint electrical signals. We use specialized adhesives to keep them fit, even if a patient is sweating. Note, always screen patients for adhesive allergies before application to avoid skin reactions. The ECG machine records these changes and draws a trace on specialized paper moving at a standard speed of 25 mm per second. Typically, we record a standard 10-second strip to provide a graphic snapshot of the heart's rhythm for clinical analysis. In conclusion, the ECG transforms invisible electrical commands into a readable story. We see the P wave, the QRS complex, and the T wave. The diagnostic dashboard enables us to determine if the timer is functioning properly and if the pumps are operating in a perfect healthy rhythm. Thank you for your attention. Understanding the ECG is the first step in mastering cardiac care. I hope this overview has been helpful. Please follow the second video to understand the basics of ECG.